Well, good afternoon, everybody. Thanks for joining us today for a coordination call with the Buncombe County Public Health Department. I'm Kit Kramer with the Asheville Chamber, and today you're going to hear updates on the status of the spread of infectious diseases, what the county is doing in response, and guidelines for prevention and preparedness. So we'll have time for Q&A at the end, so feel free to put questions in the chat. But now I want to hand it over to Dr. Ellis Matheson, Buncombe County's Public Health Director. Dr. Matheson.
Great. Thanks so much, Kit. And thank you all for taking the time to attend this call so we can have a conversation around the current measles situation. We will focus on measles, but as Kit mentioned, we are having some community spread of some other vaccine preventable diseases. Currently, though, we still only have had 3 cases of measles confirmed, and we currently have no one in isolation or quarantine. The cases were linked to South Carolina, so we do not have community spread at this time. So while I really wish we were not meeting in these circumstances, these calls are really, really important. And like I said, today the focus is going to be mainly on the measles situation. But like I said, we have had some community spread of varicella, also known as chickenpox, or pertussis, also known as whooping cough. We do have subject matter experts on the call today, including Dr. Mullendor, our medical director, and Stacy Wood, our communications specialist and master PIO. We also have David Sweat on the call, our health and human services director. So really our objective today is to distribute measles guidance for businesses, talk about exclusion and isolation protocols, and provide other communication tools, including points of contacts, and to really hear what questions that you have. Because this is going to take all of us working together. We certainly are in uncharted territory with measles, though. I have been working with Buncombe County for 22 years and started out as a communicable disease nurse. And we have never had community spread of measles since I've been working here. But the good news is that we all already have really great working relationships together, and we know that we have a caring and supportive community. We have seen this in the response to Helene and also during COVID. So I just once again really want to thank you for taking your time to partner with us so we can keep our community healthy. And with that, I am going to pass it over to Dr. Mullendor to provide some more specific information around measles.
Thank you, Ellis. Good afternoon, everyone. So, measles. So I'm just going to provide some background information about measles. And again, reiterate, we don't have local spread, but we are very close to a large outbreak in upstate South Carolina, centered around Spartanburg County, that continues to grow. And I like this analogy, so I'm going to keep saying it every meeting I'm in. The North Carolina state epidemiologist talks about it as, South Carolina has a wildfire of measles, and, embers are shooting off that wildfire. And if embers strike an area that has a high number of unvaccinated people, that's a lot of dry kindling for those embers to light on fire. And so we know that in our communities, we have pockets of highly unvaccinated individuals. And so we are highly concerned that measles will take hold here. So what is measles? Measles is a viral illness. It's a respiratory illness. Symptoms typically appear 1 to 2 weeks after somebody is exposed to somebody with measles. And symptoms start as typically a very high fever. I'm talking like 104 degrees Fahrenheit, so very high. Cough, a really runny nose, and really red, watery eyes. And then 3 to 5 days later, a rash develops. And that rash tends to start at the hairline, a red rash, and it goes down the face, down the body, and out to the extremities. And the tricky thing is that someone with measles is infectious, so they can spread their infection 4 days before their rash starts, through 4 days after their rash starts. And again, it's a respiratory illness, so it's spread through the air when somebody with measles coughs or sneezes, and it's one of the most highly infectious illnesses we have. So if we had 10 people in a room who were not immune to measles, and a person with measles walked in to that room, 9 out of the 10 people would become infected with measles. So highly contagious. Um, so it's really important that we identify individuals with measles promptly and isolate them. So this is a big thing about staying home when sick. Um, and then quickly kind of identify their contacts. And there are some things we can do as part of contact investigation. I think, Ellis, you're going to go into that further. But the key thing is that there is a safe and effective vaccine for measles. One dose of the MMR is 93% effective. 2 doses are 97% effective. And so if we can really work on those immunizations, making sure people have proof of immunity, and if they're not immune, get their vaccines, that will be a big help in this. Anything else you want me to talk about right now, Ellis?
I think that's good. We'll have
Okay.
time for questions and answer. Before I turn it over to Stacy, though, I do want to provide some information around isolation and quarantine. And yes, you probably remember that from COVID. And measles is another one of those diseases where we issue control measures, and with the authority for the local health director has authority to issue isolation and control measures per the North Carolina statute. And we do this in measles because it's so infectious that we really quickly want to contain this so that we don't get that community spread. So I want to sort of say first that if you suspect or someone tells you that they have been sick and they think that they have measles or that they've been in contact with someone with measles, you want to ask them to immediately go directly home and to call their medical provider. And if they don't have a medical provider, they can certainly call us. We have a dedicated line. It's 828-250-6100. It's our one Buncombe. We'll make sure you have that number. But when a case of measles is confirmed, like Dr. Mullendorf said, they are infectious 4 days from when their rash started until 4 days after their rash started. So we're going to place them in isolation until 4 days after their rash started, with the day the rash started being day 0. Our communicable disease nurses call people who have been infected with measles and do a very in-depth interview to understand where they have been so that we can do contact tracing. Also, probably remember that term from COVID. And so once we identify different areas that where people may have been exposed, we're going to reach out directly to people if we, are able to get their names and their contact information. Sometimes it could be a place such as the emergency department. That was the situation in the cases that we just had. And we're not going to know every single person that may have come in that space while the virus could have been in the air. So we would put out public notice for anyone who potentially may be exposed to notify us. And so when we talk to people, we're going to ask if they have documentation of immunity to measles. If someone does not have documentation, written documentation, we can't just take their word on this, then they're going to be placed in quarantine for 21 days from their last exposure to the person with measles while they were infectious. Most people are going to have immunity. hopefully people are listening to our messaging right now and going ahead and making sure that they have that documentation of immunity so that if they are exposed, this is a quick process. Um, if someone does not have documentation, it is possible that if you're still within the 72-hour window of exposure, that someone could go ahead and get MMR, measles, mumps, rubella vaccine within that 72-hour window, and they would not have to quarantine for the 21 days. So that is a generalized overview of the isolation and quarantine protocol that we're going to follow. And I'm sure there'll be plenty of questions, but I'm going to go ahead and turn it over to Stacy before we go to questions and answers.
You're muted, Stacy.
Words are hard sometimes, and muting is a part of that. Sorry. Stacy Wood, Communications Manager with Buncombe County Government. Just to support all of the points that Dr. Matheson, Dr. Mullendorf made during our conversation today. We have resources developed here locally by Buncombe County Government to help you, if you need internal communications with your employees. We ourselves have had to work through these issues within Buncombe County government. So we're happy to provide that template to you. You can tweak it and then ask questions, whatever you need. So we have internal communications templates that we are happy to provide, external communications to include signage in multiple languages. And we also have some like palm cards that you can hand out or have available to your employees. So if they see someone who, they might, it's a fine line, and I'm not going to get out of my lane here, but we do have some palm cards that are kind of a conversation guide that you can use. We have them translated into Spanish, Ukrainian, and Russian, and they all correlate with the poster that we've created that kind of is a guide. Here are the symptoms that we're looking for. You seem to have these symptoms. Let's have this other kind of, let's take this next step here and, start that isolation, protocol that Ellis and Dr. Mullendorf talked about. So, to that end, we'll follow up this call with all of those materials, make all of those resources available to you. I don't want to take up any more of this time though, so we'll go ahead and open it up to questions.
Okay,
Yep.
coming back. I'm out of practice for pressing these buttons. Anyway, we want to know if you have any questions, so please enter questions into the chat. And while we're waiting for people to populate the questions, I have a couple. So my doctor, when I first heard about this, I asked my doctor about whether or not I was immune, and I saw that. I think we sent to everyone the evidence of immunity, but can somebody summarize really quickly what that would look like? Because I ended up having to have a blood test and found out I was no longer immune despite having had the vaccination when I was little.
Yeah, so I dropped a link, and I think it's in the chat now, that goes to a webpage that shows what counts as evidence of immunity to measles. So commonly people were vaccinated as children, right? So we recommend the first dose of the measles vaccine, which is called MMR, protects against measles, mumps, and rubella. First dose is at 1 year of age. Second dose is typically right before school entry. So right before they start kindergarten. And so for children, so children who are in like K through 12 settings, or adults who are considered at high risk, so that would be like healthcare personnel, college students, people who are traveling, and it used to be really traveling internationally, but now it's really traveling anywhere in the world where there is an active outbreak. Those people need 2 doses of MMR. But for other adults, having 1 dose of MMR is sufficient. And then, like you mentioned, Kit, if you can't find your shot records, sometimes your provider can do a blood test that looks for antibodies. And if the blood test shows you have antibodies to measles, you're considered immune. And then this isn't usually one that commonly, but may become more common. If you've had measles and you had a test that showed you had measles, that's proof of immunity. And then if you were born before 1957, so birth before 1957 counts as immunity because before 1957 there was no vaccine, and so most people were exposed to measles, might have had measles, and so that counts as immunity. So this will lead me on to something else is people are like, well, how do I get my shot records? And I'm going to drop some stuff in the chat too about that. But one thing is check with your family, right? See if they kept a copy of your shot record. If you went to high school in Buncombe County, I can say Buncombe County Schools, you can go to a website they have and you can ask for a copy of your shot record. If in other counties in North Carolina and other parts of the country have this same feature, if you were have been in North Carolina all your life, there probably is a record in the North Carolina Immunization Registry that your healthcare provider or health department can pull up and share for you. And so we also have an email address for our immunization clinic where people can submit an email requesting the copy of their shot record. And then if people grew up in other states have immunization registries where you could just Google that state immunization records, and it would most likely take you to a site where you could request your records. The blood test, again, would have to be through a healthcare provider. There are options now, but it's pay out of pocket. But places like LabCorp, Quest, any lab test now, you can order your own labs. But again, that's a pay out of pocket. And you want to make sure you order, they're pretty clearly stated like measles immunity test, things like that. So
Dr. Mullendorf, I want to
yeah.
let everybody know that we're aware now, but because of intrepid chamber members who have let me know that the chat is disabled. So that's part of our problem and why we're not getting questions, and we're working on getting that fixed. So in the interim, I'm going to continue asking you questions if y'all don't mind. So from a business perspective, especially if you're in a place where any number of employees or you're facing the public. Oh, now it's working, apparently. So enter your questions. But in the interim, any recommendations for a booster in the elderly population? Dr.
Sorry, I lost my cursor. My cursor was on that one other screen.
We're
So
all
no,
out of
no booster needed. If you meet the criteria for immunity, there's no booster. And what I'll say, Kit, too, is even though your blood test was negative, so we have something in our immune system, the memory cells, so that if we're exposed to something, those memory cells can create antibodies. So it's quite possible that even with a negative blood test, if you had been exposed to measles, your body would respond. But all that to being said, if you meet criteria, if you're an adult and you've had 1 dose of MMR or you had a blood test that showed immunity, you don't need a booster. There's no indication for a booster.
Good, thanks. I'm going to ask my friend Erin, who is behind the scenes, to get the link to the previous resources and put that in the chat again, if she would please. And so here we got a question about clarifying. So does the Department of Health do all the contract tracing once we notify you who is suspected to have been exposed?
Yeah, thanks. That's a great question. And the answer is yes. We do the contact tracing in partnership with North Carolina Department of Health and Human Services. But where we need your partnership is identifying people that could have been exposed. So that's really where we'll could be working very closely together with you if if it's at your business. But we will do the specific contact tracing of the individuals and contacting them.
Okay, another question. Are there any no or low cost immunization clinics locally? Dr. Mullendorf?
Sorry, I'm trying to multitask. This isn't good.
Maybe just stay unmuted at
I
this
know.
time.
Yeah, ours, Buncombe County Health and Human Services Immunization Clinic. We are your low-cost clinic, and I'm going to drop information into the chat. That's what I was trying to find, is information about our immunization clinic that I used in a prior call to drop it in. We have walk-in hours, and we also have the ability for people to schedule appointments. And we work with you. If you don't have insurance, we have some ability to provide vaccines for free. So
Where's that located?
downtown, 40 Cox Avenue, across from the post
Okay.
office and bus station. So very convenient for those who work in the downtown area.
Okay. Are there talking points available to have discussions with the public or employees about MMR exposure and or vaccination? Stacy, you've made reference to some talking points from earlier. Can you, where would those be?
Yes, so what we are planning to do is, I think, gosh, just dropped my phone on the floor. I think we would like to share those with you all in a follow-up email to make all those resources available because some of those things are not necessarily like things we want to put on our website, but they do align with the resources that we have on our website. But we're happy to share what we've shared with our own employees, right? From our safety officer and our department directors, just things that we're aware of, questions that we've seen come into our different inboxes. So just we're happy to share that information with you all in a follow-up email.
Okay, great. So what should we be communicating with volunteers visiting from out of state about this?
I'll take that one. You want to be communicating with any of your volunteers, the same things that you would be communicating to any of your employees. And once again, really strongly encouraging people to know their immunity status. Because when you remember, I talked about quarantine, we're going to ask somebody, do they have documentation of immunity, written documentation? If people do, they will not have to quarantine for 21 days. If they don't, they will have to quarantine. So I think that message, most certainly should be pushed out. As well as, of course, you want to make sure that people are staying home when they're sick. Please, please stay home if you're sick.
With
And
anything, with absolutely anything these days. Nobody wants your germs. Dr. Matheson, could you remind us the difference between isolation and quarantine?
correct. Or yes, isolation is when someone has been diagnosed with the disease, they have the infection. Quarantine is when people have been exposed to someone and have not been diagnosed or infected with that disease. We use isolation and quarantine for many different diseases. Like I said, people probably remember this from COVID. And it's the same concept. Isolation is for people who have been infected. Quarantine is for those who have been exposed.
All right, we got the question of what guidance has been given to schools and daycares to prevent spread, particularly teachers who are not immunized. Is there a concern there of staffing in our schools?
Great question. Once again, I'll keep talking. We are also working very closely with our schools and childcare providers. We actually had a very similar call with them just yesterday, and we will continue to have routine calls with them, making sure that everybody's on the same page. They also have been provided all the guidance, documents, communications for parents and for staff. And they also are communicating with their employees and making sure that people, once again, know their immune status. That is really, really going to be key.
One of the questions we got in the chat is, will you be publishing updates on measles activity in real time?
That is also a great question. And looking at Stacy, but I'm going to say at the moment, we do not have community spread. So we are not in a situation like we were in COVID. We are not to that level, and we want to keep it from that level. So currently, we do not have a plan to have like a dashboard on Buncombe County's website. We do have a daily media briefing call currently, and during those calls, I'm providing any status update for that. For example, like today, we still only have the 3 cases. We have not received any more new cases, and we have 0 people in isolation and 0 people in quarantine.
That's good news. All right, if we work at a university and host athletic events or play games in the Spartanburg and Greenville area, should we be in communication with the Department of Health while in those areas or when hosting teams from those areas?
So you don't necessarily need to call us to say you're going there, but I think it is very, very important that you are very aware and that there is a very large outbreak going on in South Carolina. Today, they did their new update, and I think there was 124 new cases just in the last couple of days. So that outbreak is nowhere near under control. And so I would encourage schools, recreational sports to be very conscientious of that. And, you have to make your own decisions on whether or not to go. But once again, know your immune status. Very important.
So are you contagious after exposure, but before symptoms show 1 to 2 weeks following?
You are not. You are contagious 4 days before your rash begins and 4 days afterwards. I will say, though, the rash doesn't show up until a few days after you've started with the fever, the runny nose, and the red eyes that Dr. Mullendor described. So people may think, oh, I just have allergies or I just have a little bit of a cold. And that could be within that window of the 4 days prior to the rash showing up. So that's lots of times where we can see a lot of these exposures.
And I'm sure you've said this, but how long do symptoms typically run for if you have measles? How long are you going to be sick?
Well, again, isolation is going to end 4 days after your rash. And I would say most people are feeling better at that point. It might be a few more days longer than that, but it's not like the days of COVID where those early days of COVID where I feel like we were isolating people for a very long time. So.
Okay, that's good to know. Again, if you want to find where you can get your immunization records, Dr. Mullendor posted.
I think Stacy put stuff up earlier.
Stacy posted.
And then I just put this stuff.
So there are the Buncombe County Immunization Clinic can help you find your records. It's further up in the chat. So scroll back up to look for that if you need to. Are there any suggestions for helping and or educating the homeless population?
I have shared information with Lacey Hoyle, who's our Buncombe County staff member who works with homeless service providers. So that information should have gone out. And Lacey is our point of contact. So I told her, any questions she gets to funnel it back up to us in public health.
Great. If we're notified that an employee thinks they have an exposure, do we need to notify Buncombe County DHS? How do we notify Buncombe County DHS? The one Buncombe number?
Yes, you can absolutely use that number, and it can also connect you with one of our communicable disease nurses. But this is where our partnership really comes into play. If you are suspecting, then please go ahead and give us a call, and we can work through to identify what the next steps need to be. So yes, one Buncombe number, 828-250-6100, and I believe it is in the chat.
And unless the employee tells you they're calling the department, then you should probably do that and just give them a heads up. All right, to be proactive, should I ask the teachers I currently supervise in multiple child care centers in both Buncombe and Madison County to go ahead and obtain their own evidence of immunity? I know this could take several days for some teachers. Unfortunately, I do not have enough substitutes covered teachers who have to quarantine until they can show evidence of immunity if we indeed have someone diagnosed.
Yes, would be the answer to that question. We had a call yesterday for childcare and K through 12 administrators. So if you weren't on that call or on the invite list, Stacy, I know we're getting ready to send out some information to that group, specifically to that population. So we can try to, let's see. If you get emails from Chrissy Wolf, you'll be getting it. Otherwise, if for whatever reason you're not involved in getting emails from Chrissy Wolf, then I guess drop your email address in the chat and we'll follow up with you.
All right, this question is, how much roughly does it cost employees to go and get an MMR vaccine? Is it an expensive vaccine to obtain for facilities who wish to offer it to staff?
So if somebody has health insurance will cover the cost of the vaccine. If someone is uninsured, it depends on where they go. So if they are an uninsured adult who has no documentation of a prior measles, mumps, rubella shot, we can give it for free at the Buncombe County Health and Human Services Immunization Clinic. And we are well stocked with MMR, and we are going to maintain our good stock of the vaccine. And then for facilities who wish to offer to staff, I mean, it would have to be a facility that is used to, giving vaccines. So I'm not sure what kind of facility that is. If it's a healthcare facility, I mean, I can't speak to the cost of it, but again, maybe reach out specifically. Maybe I'll drop my email into the chat, and you, Beverly, can reach out specifically to me, and I can maybe direct you to our vaccine coordinator staff.
I mean, you would need to have a volume of people to make
Yeah.
on-site vaccination really something you should consider. So
Yeah. And if
maybe
you're
instead you
yeah.
direct them to the immunizations they can't do.
But if you're a healthcare provider and you're seeing people, like if you're an urgent care center, I'm not sure where Beverly works, but we would love for more providers to be offering MMR in the community in case you have people who come in who need it.
Okay. Any differences in recommendations for skilled nursing facilities?
Skilled nursing facilities. So again, all healthcare personnel are supposed to have documentation of 2 doses of measles, mumps, rubella vaccine. That's been longstanding guidance from the CDC. And so I can drop a link in the chat that's specific to healthcare personnel vaccine recommendations.
Any specific recommendations for employees from other countries who are working here on visa status? You guys are asking great questions here. We're testing these panelists.
I mean, again, everybody, we need to know their immunity. So I mean, I see patients and sometimes, they don't have records of immunity. They're in their home country. And so if they can't produce those records, encouraging them again, come to the health department or if they have a healthcare provider, getting blood work.
Okay, we have a participant who had measles as a child in another state, and her only written documentation is a note from her mother. This is her known immunization status. Is this good enough if she was exposed?
No, notes for moms don't count, unfortunately. But this might be one where potentially getting a blood test to show the antibodies would work. Or again, it's not harmful if people have had the vaccine but can't find their shot record, or even I would say if somebody had measles but doesn't have documentation that meets evidence, getting a dose of the MMR would not be harmful.
And it didn't hurt. At least it didn't hurt me, and I didn't have any
Right.
reactions after either.
Right.
Do you recommend any specific cleaning of common areas, especially on a college campus where we have residence halls and dining halls? Stacy? There we go. Unmute.
Well, I do know that Jessica Silver, our environmental health director, there she is. Hey, environmental health director has joined the panel. So go for it.
Jessica?
Hey everybody. Hello. I thought I was going to get out without a question, but here we are. I would say follow use normal disinfectant products, like a bleach and water solution works great. On most things. That would be my contribution to this.
Okay.
The issue will be, right, if somebody, this is where it gets tricky. So, in terms of measles being an airborne virus, it stays in the air after the person leaves. And so, like for a healthcare setting, if I see somebody in an exam room and I'm like, oh, this person might have measles, I have to leave that room unoccupied for 2 hours after the person leaves. So, this becomes difficult when this is where this spreads so easily, right? As it's not just when the person's around, but it's after the 2 hours after the person leaves. And so, if a business had somebody who they suspected of having measles, or we suspected of having measles, if they had an office, we'd want to keep that office door closed for 2 hours. I mean, it gets really, that is one of the more difficult things about measles, I'll just say. So yes, but the cleaning that Jessica mentioned is for the surfaces, but the air is a whole nother can of worms.
All right. Are there populations that are more prone to getting measles?
Those who are unvaccinated.
Yep.
That's the biggest population, I would say.
And again, there's a question. You need to know your immunization status about whether or not, if you got a vaccine as a child, you need to know whether you're still immune or get a booster or chance it. What has the increase caused more families to have their children immunized? Does anybody know that? I don't know.
We've seen some people come in over, like since, it was last year when Texas had the big outbreak, and then South Carolina started in the fall. We've seen some people come in who said that they had not vaccinated their children. So we've seen some. I don't think there's a mad rush coming in, but seen some.
If a student is suspected to have been exposed but refuses to isolate or quarantine, what role does the health department play?
Yeah. So as public health director, I do issue written isolation or quarantine orders for the person based on what they need. And it describes specifically in that order what the person needs to do, when their isolation or quarantine will be over. And it also references the statute, and there can be legal consequences. You could be issued a misdemeanor.
Okay. We got a reiteration of the question about if you had a vaccine as a child after 1957, would you need a booster?
If you have written documentation of it. There is, I'm going to pull up my email because I can't keep this in my brain. So some people who might have received an MMR vaccine between 1963 and 1967, they might have gotten a type of measles vaccine that wasn't as effective. And so those people, if they got a dose of vaccine during that time frame, or they're unsure what type of vaccine it was, or they know it was the inactivated or killed measles vaccine, they're supposed to go ahead and get a dose of MMR. But if you know that you've had it, you have documentation of it, you don't need a booster. There's no such thing as a booster for measles.
Do you have a flyer, website, or list of places, online portals where people can get their shot record for free? And Stacy, you were referencing that we'll send information with talking points, but can we also, that information has been put in the chat previously, but you'd have to scroll back up to find it. But Buncombe County Health Immunization is where you would get that information, correct?
Well, we can help. Again, we don't have access to everything. If
Okay.
it's in the North Carolina Immunization Registry or in our system, we can provide that to you for free. If it's in another state, then that's, we can help people sort of problem solve, like figure out where might it exist, but we're not going to be requesting records from Florida for you. Like that's going to be on the individual to reach out to.
But you can
We
provide
can direct them in
provide advice on how to find it. Okay. And Stacy, anything you want to add? Because you're unmuted. Okay. All right. Do immunosuppressed individuals require a booster? Even though there is no such thing as a booster.
Sorry. Yeah, there is. So people, let me find the specific wording, but there is recommendation that people who have HIV or have some immunizing conditions, those are some high-risk people that might, instead of needing one dose of MMR, will need 2 doses. So let me find that verbiage, and
well, and perhaps check with a doctor.
Always check with your
doctor
healthcare
you go
provider.
to, and that's what I ended up doing, and how I found out that I was supposedly no longer immune. All right. If vaccinated in 1963 through 67, will the blood test show if you were immunized appropriately?
If you got, you could do that. That would be fine.
Get a blood test.
Yeah, that's fine to do if you wanted to, versus just getting an MMR. The issue is sometimes, like, if you get a blood test, so you've paid for the blood test, and then it shows you don't have immunity, then you got to go get the vaccine. You know what I mean? So sometimes it's just easier to go get the vaccine.
Okay. How should we handle a student who has a religious exemption on a college campus?
Great question. And I would say that any person who is choosing to exempt out of the vaccine needs to understand, if they are exposed and they do not have written documentation of immunity, i.e. no vaccine, they will have to quarantine for 21 days after their exposure.
All right. This is a 2-minute warning. We've got 2 minutes left in this webinar to answer questions. To clarify, if someone doesn't have evidence of immunity and they're willing to just get an MMR in lieu of blood work to obtain evidence of immunity, that's an equally acceptable current recommendation as opposed to going and getting a blood test first. Yes. Okay. How do you want people to reach out to the immunization clinic for records? Should they call the clinic? Or
the best way is that email address, because like our phone lines, like that's going to get bogged down. That immunizations@buncombenc.gov, send an email, and that will be the most, in terms of efficient way for us to manage these requests.
Okay, immunizations at Buncombe County
buncombenc.gov. It's
nc.gov.
high up in the chat, but it'll be included in the information.
Okay.
And I
Um,
have that information. I'm going to put in the chat, but because we're running out of time, I'm going to say the 2 doses. So that question about immunosuppression. It's household and close contacts of immunocompromised people and people with HIV who are not severely immunosuppressed. Those are individuals for whom 2 doses of MMR is also recommended. So it's not the immunocompromised themselves, it's their household and close contacts, or again, people with HIV who are in treatment and are not severely immunosuppressed.
is there going to be another webinar? Public health friends, Stacy?
If
See,
we need it,
Stacy,
yeah.
but as public health director, I am happy to continue to have conversation because we all need to work together to keep our community safe. So whatever you need and however we can support you, we're happy to do that.
Well, I hope we don't have a need, but we certainly do appreciate the level of partnership, the request that came from the county for us to collaborate in doing this. And I appreciate all of you who have been on the call today. We want to keep our community as healthy and operating well, and our workforce healthy, and our kids healthy. So thanks very much for participating, and we will make the recording available. I'm not sure how that's going to look, but we've got some ways of sending back information. So the email address you mentioned was immunizations at buncombenc.gov. Immunizations at buncombenc.gov. Thanks everybody for your time. We appreciate you, and stay healthy.